Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today. How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
This is a very important question because though the ideal BP is 120 by 80 mmHg, but all people cannot have the same BP. There is a range. So the upper number that is called as a systolic BP is normally between 100 to 140. And the lower number, which is also called as a diastolic BP, is 60 to 90. Anything in between these numbers is a normal BP.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
So very important is lifestyle changes. When it comes to lifestyle changes, the first thing that I would always tell a patient, if the patient is obese, then the most important thing is that the person should lose weight. Second thing is that the intake of salt should be adequate. Thirdly, anything which is of high carbs like fried fatty foods should be reduced. The person should ideally stop smoking and alcohol, and the most important thing is a regular exercise or walk should be incurred in daily basis.
Can we say that hypertension can be treated without medication?
So hypertension, as I have been continuously saying, is a lifestyle disease. So if you have improved your lifestyle, if you have decreased your weight, if you have limited your salt intake, then yes, you can get off hypertension medicines. But most of the times, it is better that we continue with a small dose of antihypertensive drugs with continued lifestyle modification. They will help you in the longer run to protect the heart as well as the kidneys.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
As I said, yes, sometimes it is possible that if you have been able to do some lifestyle changes and do maintain them, you can come off medications. But mostly it is very beneficial if we take a small dose or a limited dose of antihypertensive drugs with continued lifestyle management. This helps you protect your heart, kidneys and other organs.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
So basically BP should be monitored at least 2 to 3 times in a week. Before checking the BP, a couple of things are important. Firstly, the cuff should be of adequate size. You should sit down yourself calmly. You should be well rested. No caffeine or smoking in the previous half an hour. While checking the BP, make sure that your arm and your heart level is at the same level.
I would also like to know what would happen if high blood pressure gets untreated for years, and what parts of the body gets affected the most?
So basically, an untreated hypertension can affect almost all the organs of the body. But very importantly, what we fear is complications of untreated hypertension can cause heart problems, heart failure, kidney diseases. You are at a very high risk of stroke. You have vision problems, even dementia.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, win over hypertension.